You came here for a very specific reason, and for reasons that most of the people that we see don't have. Your profession really kind of mandated that you get this under control.
Yeah, I was in jeopardy of losing my livelihood, not making no money in my CDL, because I researched it, and over 28,000 drivers have lost their license because of sleep apnea, which I felt that I didn't have. But
yeah.
Coming here, you explain things to me.
So, and you've really gone through a lot. You had the palatal surgery.
Mm-hmm.
What was that like for you?
It was very painful. A lot of it was, it was painful. I couldn't talk, choking, couldn't swallow. Had to eat Jello for 2 weeks. But if you want to lose weight, well then get it. Because I lost a lot of weight, and I kept it off.
And what my understanding is that once you had that palatal surgery, it made it, and they found that it really wasn't as successful as they had hoped. It made it almost impossible to use the CPAP machine.
Yeah, the CPAP machine was actually...
To use the CPAP machine.
Yeah, the CPAP machine was actually gagging me. I think I had a bad sleep study test, but, they increased the pressure going down my... And I couldn't take it, and that's when I told them, I said, I'm waking up more tired than I ever did because the CPAP machine was just totally uncomfortable, and the air was just... And they were going to try to work with me, fit me with masks, and I says, I don't want to wear it. It just doesn't work.
Yeah.
Like it did before. Because before I had the operation, I was wearing it. And it didn't bother me. But after operation, it kind of opened everything up.
It made it more difficult to wear.
All right.
And then you came here hoping that an oral appliance was going to be helpful for you. And one of the things that was kind of interesting to me is that when you came here, even though the sleep study did show that you clearly had sleep apnea, you didn't feel tired. And then you got your oral appliance. Mm-hmm. That was a pretty easy adjustment for you to get used to that?
Oh, yeah. It was... Yeah, it made my teeth a little bit sore, but it wasn't annoying or nothing like that. You get used to it. And... I put it in, and it helped. Because I didn't think I needed the help. I really didn't. All I was wanting was something to pass the sleep test. Because it's my job that I needed to do. That's all I wanted it for. But I took, I used it, and I took it out, and then I go, yeah, there is a difference. I noticed a difference.
So you can tell a difference when you're wearing it and when you're not wearing it.
Right, because I did not wear the oral device for 2 days.
Just as a test.
Just as a test, just to see. And an alarm had to wake me up before. Now I don't need an alarm. I'm 6-7 hours sleep. And boom, I'm up.
The thing that is so dramatic is that the home sleep study that we did shows that there's just virtually not a trace of you having any kind of sleep apnea at all. So you should have no difficulty maintaining your commercial driver's license now at this point.